I want to thank you, the associations and NGOs in New Zealand, as well as the Abortion Law Reform Association in New Zealand, for inviting me to speak to you for a few minutes about the issues that you are raising in this conference. As the rapporteur of the UN on the right to health, I want to make it clear that the right to health includes the right to reproductive health and health services, facilities and goods. Unfortunately, a large number of countries criminalize abortion and family planning services in different modes and different ways. This has an impact on the availability, accessibility of reproductive health services. First of all, it actually interferes with the woman's right to autonomy. It actually interferes with her access to these services. It undermines her dignity to do what she decides for herself. It also raises stigma and increases stigma of a person who wants to access services because of criminalization. Most unfortunately, large number of countries, because they criminalize sexual and reproductive health services, including family planning, what it means to an individual, particularly women, is that they are not able to prevent unwanted pregnancies, and large numbers of deaths result as a consequence. It is now well established that those states who do not criminalize family planning and health services and reproductive health services, including abortion, those states are able to avoid unwanted pregnancies, avoid preventable deaths. So it's very clear that not only is it a human right, but also that it is good, it has good public health outcomes. Unfortunately, criminalization of reproductive and health services, including abortion and family planning services, are disproportionately impacting on women and girls. This also has an impact on information being available to those who need it. Criminalization actually hinders access to information. It is very important that proper, appropriate and accurate information and education is available of reproductive health services, goods and facilities for women to actually access, so that they can use those services and facilities and goods. Unfortunately, criminalization hinders that. It is in this context that I, as the UN Special Rapporteur, have recommended in my report that there should be decriminalization of the supply and use of all forms of contraception and voluntary sterilization for fertility control, decriminalization of provision of information, suspension or abolition of the application of existing criminal laws to various forms of conduct during pregnancy, decriminalization of abortion itself, including related laws, and ensuring that evidence-based accurate information is available so that abortion can be performed when it's legally and publicly available, and that healthcare providers are not stigmatized for using those services. Thank you very much.